Hi, I'm Elizabeth Krupinski. I'm the Associate Director of Evaluation for the Arizona Telemedicine Program and the Co-Director of the Southwest Telehealth Resource Center. I'm also in the Department of Radiology and Imaging Sciences at Emory University. I'd like to talk to you today about taking telehealth mainstream, some key considerations. Now, I have no financial disclosures. A recent report came out from the U.S. government, from the Government Accountability Office on telehealth and remote patient monitoring. And what it did, it surveyed 6 associations representing a variety of providers of healthcare services and 2 associations that represent patients. And it asked them a variety of questions regarding whether or not some of the factors that would encourage the use of telehealth as well as remote monitoring, as well as what some of the barriers are. And as you can see from this, some of the factors that encourage telehealth are alleviation of provider shortages, convenience to the patient, cost reduction, enabling the use of emerging technologies, and so on. And both the patients and the providers express those points of views. The same thing for remote monitoring. Alleviating shortages, coverage of service, emerging technology, improving and maintaining the quality of care. When it talked about some of the barriers that were of concern, cost increase, coverage of services, the pace of changing technology, and so on, providers and patients had slightly different factors of concern. For example, patients were more concerned with coverage of services, cultural factors, the pace of changing technology, and so on. And the results are very similar for remote monitoring. Well, when I saw this, I kind of said, well, you know, we kind of know all that. Thank you, Captain Obvious. You know, we've been saying that in the telehealth arena for well over 20 years. To some extent, that train has left the station and really is barreled through the station. Telehealth is really out there. It's being used. The question really is, what's going to push us over the edge? What is really going to help take it mainstream? I think there's a number of factors that will do this, and some important ones to consider. This is a graph of that's really quite interesting, and it shows the changes in the types of healthcare providers going back to the 1850s. Really through the present. And as you can see, starting here back in about 1850, most of the providers were physicians. And as we go through the 20th century and into the 21st century, the variety of providers that we have, RNs, LPNs, technicians, and so on, is just increasing dramatically. What's interesting to note, however, is that the number of physicians, MDs, and I believe this incorporates DOs as well, has really not changed very much in the past 150 years or so. And I think this is one of the driving factors that's going to change the healthcare system and really help promote telehealth in general, because you don't have enough primary care physicians and physicians in different specialties to really deliver the healthcare that we need. We have all of these other providers that can really reach out to the patient and do a much better job, perhaps, of making that connection to patients who are underserved or in rural areas. I think there's also new rules of competition. For example, in radiology, back in 2006, the tagline for radiology was to grow by being bigger. And success was measured in terms of getting a share of exams, strengthening service lines, solidifying referrals, increasing utilization, so on. Jump ahead to 2016 and 2017. Now the motto is grow by being better. So some of the success factors now are shared of covered lives, competing on outcomes, minimizing cost, offering convenience, expanding access. Well, if this isn't what telemedicine is all about, I don't know what is. So there really are fundamental changes in the way people are approaching practice. Now, these are some of the rules and regulations here in the United States, but every country has their own regulations. And funny, they all never have real names. They're all made up of some acronym, and I call it the scary acronym soup. And some of the regulations here in the U.S. are MIPS, MACRA, APMS, and so on. But it's changing the way healthcare is delivered because it's changing the way that healthcare is being reimbursed. And that includes telemedicine and telehealth services. And I know these laws don't apply at the international level, but again, I think every country and even local regions have their own set of rules and regulations that they have to adhere to. And some of these regulations are impacting the delivery of telehealth services. I think another thing that's going to tip us over the edge that's driving the transformation of healthcare into telehealth is the general intersection of healthcare and IT, informatics and information technology. And as you can see from this figure, it really is made up of a whole variety of things. There's the electronic health records, you've got billing, insurance, and reimbursement for expenses, you've got patient education, electronic health information exchange, research and analysis, and so much more where IT is really impacting healthcare. And I'm not one to say that technology is important in healthcare. It certainly is, and it drives where we're going. But it's the conglomeration of all these pieces of information. The key thing for telehealth and telemedicine in general, as well as healthcare in general, I think, is how do we integrate all this technology into the healthcare experience and the healthcare enterprise to make it useful for physicians and patients. Another thing that kind of speaks to the technology side of thing that we really have to change is electronic healthcare record burnout. I don't know anybody who really loves their electronic healthcare record. And a lot of physicians and other healthcare providers are really spending much more time than they have to dealing with the healthcare record rather than the patient. And I think as we transform in this direction, again, in line with regulations and with the desire to make things more efficient and cost effective, healthcare records are going to have to get much better integrated into our healthcare system and make telehealth possible as well. This is a picture. I'm asking you virtually, does anybody know who this is? Who it is Vinod Khosla. He's the founder of Sun Microsystems. And he once proclaimed, not that long ago, that machines will replace 80% of doctors. And this obviously created a lot of backlash from the medical community. People don't like to hear that they're going to be replaced by machines. He kind of backed away from this. But then less than 2 years ago, he came out with another statement that said the role of the radiologist will be obsolete in 5 years. Now, obviously, I disagree with both of these comments. However, I do acknowledge and actually welcome the fact that AI, digital diagnostics, computer decision support systems are going to be pervasive in the healthcare system. They're certainly going to work in the realm of telehealth. And I think what we have to do is look at these AI solutions, these deep learning techniques, decision support, and integrate them into all of our healthcare systems, and especially in telehealth applications. If we can leverage technology, the hardware and the software, to reach out to rural physicians and so on who are not specialists, give them the technology, but also give them the software, perhaps the artificial intelligence, to help them interpret the data that they're getting. I think that really is going to help us, again, push telemedicine over the edge. Now, there's a whole variety of models that exist for telemedicine. And there's a lot of ways of delivering telemedicine. The most traditional model is the hub and spoke model that's been around for well over 20 years, where you have one sort of central specialist organization providing and connected up to a variety of spoke sites. This kind of turned into employer-based as well, where companies, for example, would hire telehealth companies so their employees don't have to leave work, or also providing to their employees the option to get telehealth services rather than traditional based, or in addition to traditional based, so they can save costs and travel, etc. as well. Service providers are becoming incredibly popular and very useful. These are companies that create platforms where they provide specialist physicians to all sorts of sites, large, small, in different clinical specialties. They take care of the licensing, the credentialing. Quite often they take care of the billing as well. But they help various institutions who don't have specialists or who need specialist coverage on certain times, for example, weekends and holidays, by providing those physicians in a virtual setting to complement what local clinics have on site. And finally, there's the direct-to-consumer model, or DTC, where patients can literally go into a kiosk or right online and access physicians on their own without a healthcare system as an intermediary. Patients pay out of pocket, and this again is becoming a very popular model for people who don't want to leave their house, maybe have an urgent care request but don't want to go to the emergency room. And there's controversy around these, but they do and they will continue to have a place in the healthcare system. There are a whole variety of ways that telehealth can be delivered. There are video consults, there are remote patient monitoring, data streams, mobile health using different mobile applications. There's e-visits where, for example, physicians get second opinions and consults via email, store and forward or asynchronous applications, and a whole variety of technology services as well. And not one of these models is better than the other. I think what people need to do when they're engaging in telehealth is pick the model that best suits their particular circumstances and applications. The ECHO model is a very interesting model as well. It was developed at the University of New Mexico, and you can find more information by just following this link, echo.unm.edu. But it really is a revolution in medical care, and it sort of combines the tumor board concept with patient care. So for example, you might have an hour session where an expert in infectious disease, which is where all of this started, starts a session, and then providers from rural sites log in. The specialist gives a didactic lecture for a half hour, say on the state of the art on treatment for hepatitis C, and then the second half hour is dedicated to some of the physicians who log on, or the other healthcare practitioners who log on, to discuss specific cases and get recommendations for diagnosis and treatment from that specialist. This is an incredibly popular model, and it's just catching on like wildfire in a whole variety of circumstances. Now, another thing that's going to push telemedicine over the edge and make it go mainstream, I think, is research. There's been a lot of research in the past 30 years dramatically supporting telemedicine. And research in general in telemedicine, there's sort of the good, the bad, and the ugly of telemedicine research. And the good side is for telemedicine is that like I said, there's about 30 years of solid research out there in a number of key journals. And we're at the point where we're actually doing systematic and meta-analysis type reviews. And they're looking at all sorts of things like outcomes, cost and time savings, looking at the empirical foundations, developing different types of cost analyses, and looking overall at the weight of evidence that says telemedicine works. And I think this is sort of, like I said, the good side of research is there's a lot out there and really quite advanced. We're doing systematic trials. The bad is that to some extent telemedicine is held to a higher standard than traditional healthcare. A lot of times people are saying, well, telemedicine and its interventions should result in better outcomes. Yes, it would be great if the outcomes were better from telemedicine, but originally that's not what it was for. It was simply to provide services in another way using telecommunications technology. And if the outcomes are the same as in person, that is really a great outcome as well. The duality of it is that there are other things that we can measure with telehealth, not necessarily outcomes per se, clinical outcomes, but for example, how many patients receive consults when those services are not locally available? Are there reductions in wait times, travel, anxiety because they're getting their appointments quicker? Yes, cost comparisons. I'm not going to lie to you and say that telemedicine is a cash cow. You should go into it and you're going to make a lot of money. Healthcare in general doesn't make a lot of money, and telehealth is no different. You can make it sustainable, and there are many ways to look at telemedicine, as I said. The ugly side of telemedicine research, you know, in the United States at least, the funding for research from the federal level has gone down. It kind of goes up and down. It wavers over the years. It's always in threat. And I'm sure budgets in other countries for healthcare research are the same as well. But overall, I am convinced that we need research. We need more research. Why is that? Because clearly there's a need, I think, for telemedicine. And because of that need, technologies are developed. When technologies are developed, research has to ensue to make sure that those technologies are reliable, are valid, are accurate, are doing what we think they should do. They develop different types of applications. All of this research and so on develops a body of literature, and that body of literature can guide policy. And all of these, it's not just a circle, there's a big spaghetti connection between all of these things. The key point being, I think, that research can guide policy, and policy is what makes telemedicine acceptable, reimbursable, and promotable to patients in healthcare systems. A lot of people kind of ask me, you know, how can I get into telemedicine? How do I know what to do? I'm a clinician, a healthcare provider. How do I know how to do it? There's actually a lot of guidance out there, and some of those are practice guidelines. The American Telemedicine Association has about 25 different guidelines. I've just highlighted some of them here, the most recent ones. Operating procedures for pediatric telehealth, tele-rehab services, telestroke practice guidelines, incredibly useful modality for telemedicine, and practice guidelines for telemental health in children and adolescents. There's also one on primary and urgent care. If anybody wants any of these, can't get access to them, I have copies. Please email me. My email address I'll present at the end. I'd be glad to give you any one of these documents. And like I said, there's about 20 of them. There's also a whole variety from professional societies, not just the ATA, the American Academy of Pathology, the American College of Radiology, the Speech and Hearing Association, psychiatric. So there's a lot of guidance out there. There's also the need, I think, obviously I already said there's a need to do research in telemedicine. There's also a need, I think, for programs to simply assess themselves, to periodically sit down and evaluate what they're doing and what their impact is, whether or not they publish, you know, preferably they do. But I think what's important is to actually find some things that you can measure so you can show people that your program, your telehealth interventions are working. And this is the document also from the American Telemedicine Association. Again, I can provide it if you want a copy. It's called A Lexicon of Assessment and Outcome Measures for Telemental Health. It's not only for telemental health, however, these metrics are generalizable. And what's neat about this document is it provides a number of items that you can measure, metrics. It provides nice definitions. It provides ways to measure them, and then some considerations. And there's a whole list of them. For example, provider and patient satisfaction, integration of care, usability, rapport with patients, no-shows. Every clinic in real life with patients seeing in person have no-shows. Telemedicine has been shown to reduce the number of no-shows. And so that's a very simple metric that you could utilize to measure the impact of your program. Symptom outcomes is another big one. Those are the types of clinical outcomes. Completion of treatment. How many patients of yours do not complete their treatment regimen for whatever reasons? There's evidence that telehealth interventions, reminders, and so on can help people complete their treatment successfully, increase the quality of care, increase treatment utilization, get patients on the right medications and so on, provide more services, simply counting how many telehealth encounters you have, reducing wait times, reducing length of sessions, reducing the distance providers and patients have to travel to give services, cultural access. You can do a whole variety of economic analyses, cost-benefit analyses, travel, direct and indirect costs, technology costs, cost avoidance, missed obligations, burdens on the social network, reduction in supplies that are used. All of these are things that telemedicine interventions can have an impact on, and they're clearly measurable. Patient safety, resource utilization, and so on. So these are really solid metrics that I really recommend that if you go into telehealth and telemedicine and you want to make it go mainstream, again, you're going to have to convince people that it's working. And these are some of the metrics that you can use in a program assessment. I also think in order to make telemedicine go mainstream, it has got to be integrated into curriculum. Right now, I think nursing schools are pretty far ahead of most healthcare professionals. Med schools are a little bit slower, but I think they're evolving. More and more nursing and medical schools, osteopath schools, allied health professionals are integrating telehealth into their programs. Some of them are making it requirements. A lot of them have rotations through telemedicine programs. So I think this is going to be absolutely critical. We have to train and expose our young healthcare providers to telemedicine, just make it part of their natural routine, another way of delivering care, and that's how we'll make it go mainstream. It's also scattered in some public health programs, management information systems, informatics programs, biomedical engineering, and so on. This is important from the perspective of this is where the research gets done, this is where the new tools are developed, and so on. I think things like the AAMC professional boards where you get board certification, professional societies, I think they need to step up now and demand that telehealth training is required as part of professional development and training. But it's not just the technology. We can't just train them how to use an electronic stethoscope or use some of these peripherals and tools. We have to teach them about etiquette, about the culture of telemedicine. And it can't just be this separate course or track or something that is special. We have to integrate it into the normal routine of education and clinical practice, and that's what's going to make it go mainstream. We also need to educate our patients that they have the option to engage in telehealth if they want to. If it's more convenient for them, if it's going to give them access to specialty cares, we need to educate them about that. And in general, I think we need to increase and promote health literacy. This is just an example of one of the training sessions that we do at the University of Arizona with our Arizona Telemedicine program in the Southwest Telehealth Resource Center. We provide on-site training and simulation, I think, is one great way to get people to expose to telehealth. What we do is we bring providers in. This is for telegeneticists. We do about 8 at a time because you can't, just to keep it convenient. And each of the participants has to rotate through different stations. In one station, they have to be a patient, for example, with a genetic problem or is concerned about something, a hereditary breast cancer perhaps. And then in one circumstance, they have to be a counselor. This would be their normal job, but they need experience in that. When you're not a patient and you're not being a counselor, you're observing those two people engage in a session. We also have some didactic sessions before or after the training, either virtually or on site. And what this does is allows everybody to feel what it's like to be a patient in a telehealth encounter, to be a counselor or a provider, and then afterwards to get the criticism, the critique, the pats on the back for doing it well from your peers who are watching you. And I think this is a really great way to engage and get people trained on how to do telemedicine. Now, if you can't do something like this, I highly recommend that if you got new providers and they're not sure how to do telemedicine, simply sit down and do some fake sessions. Have somebody pretend to be a patient, set up your equipment, and have that provider sit down, turn the system on, say hello to the patient, and engage in an encounter so they get used to it. There are some quick guides or some cheat sheets, in a sense, again, provided by the American Telemedicine Association to help people understand sort of the etiquette of how to do a telemedicine encounter. This is just one. It's called A Concise Guide for Telehealth or Telemedicine Practitioners on how to make eye contact. It's surprising that, you know, when people sit down in front of a computer with a camera, it's not always the easiest or most natural thing to make eye contact with somebody on the other side. We also have a quick guide on how to set up the lighting in your room. Another very important aspect is how to create an environment that's camera worthy or television worthy. This is another sheet that was developed by the National Consortium of Telehealth Resource Centers. This is something you could, for example, provide to your patients to educate them about telemedicine, talking about why telemedicine is popular, what it is, what it is involved, what they need to know before they go into a telehealth encounter, and how can they prepare themselves. Again, I can provide any of these materials for anybody who might want to use them. So in conclusion, you know, telemedicine is going mainstream. I showed a steam train before, but I really think telemedicine is a bullet train now. It's just barreling through, and it will be here and everywhere around the world as an integrated part of our healthcare enterprise. I still hope for the day when it's not called telemedicine, but it's simply medicine, and it's what we're doing every day. I think that the legal and reimbursement barriers that a lot of us are facing around the world are going to fall. Unfortunately, new ones are always going to take their place, for example, data responsibility, but slowly all of those things will fall down. Technology, as we know it, is going to morph. There's going to be more wearable and implantable sensors, automatic tracking tools and communication that are going to provide automatic and accurate feedback to physicians as well as patients about their healthcare status. I think the absolute key to making telehealth work and making it mainstream is process and workflow integration. If it's not integrated into the workflow, it is simply not going to work, because telemedicine is about the people. It is not about the technology. We really, really have to integrate it. And as new technologies like artificial intelligence and clinical decision support tools come out, it is the new reality. And that is part of telehealth as well. And we are going to have to integrate that as well into our telemedicine and our healthcare enterprises in general. So thank you very much for allowing me to do this virtual presentation to everyone. Again, if you have questions, please do email me. My email address is right there. And I can, again, provide as much information that you want. I have all those materials with guidelines, with some of those information sheets. Please reach out to me, the Southwest Telehealth Resource Center, or anyone else that is practicing telemedicine, because that really is one of the best ways to help you make it go mainstream in your healthcare enterprise. So again, thank you very much, and good luck with your telemedicine programs.